Coronavirus is now a global crisis. Patients who are not significantly ill should not go to a physician's office, clinic, or hospital. Still, patients continue to have needs, and chronic diseases must be properly managed. In my world of electrophysiology, for example, many device clinics have decided to cancel routine device checks for pacemakers and ICDs. However, it's still very important for these devices to have ongoing management and for these patients to have clinical touch points. Many of my colleagues are turning to telemedicine for non-urgent visits. My colleague from Twitter, J.K. Han, who is from UCLA, has tweeted about her experience in beginning these visits with telemedicine and remote monitoring, and she's had good success with her patient management. Remote monitoring of devices is standard of care and has been for a long while. According to one meta-analysis, for every 1,000 devices that are remotely monitored, we save nearly 50 lives, and we prevent 25 strokes. We also prevent numerous hospitalizations for heart failure. However, remote monitoring of devices continues to be something that many clinics only use on occasion and is only an afterthought. Telemedicine began to really pick up steam in the last decade. Initially, it was really just used as a way to reach patients in remote locations, provide them with specialty care in remote locations. It was born out of necessity. Now, insurance companies see telemedicine as a way to save money and reduce the impact of patients on the overall healthcare system. According to a survey by American Well, physician use of telemedicine services have increased 340% between 2015 and 2018. There were 22% of doctors used it in 2018, and that was up from 5% in 2015. The coronavirus gives us an opportunity to expand that further. 34 states and Washington, D.C. have laws mandating that private insurance companies cover telemedicine services in the same manner that they cover in-person services, which is a big deal for providers. Patients are now much more open to this type of visit as well. According to a survey in 2017, 77% of patients would consider seeing a physician virtually. Now with the coronavirus crisis in full swing, I believe this demand is only going to increase further. Patients want to get care, but they don't want to take risks when they get that care by going to a physician office or hospital. While the coronavirus spreads rapidly throughout the globe and social distancing is now the norm and seems to be the new standard for mitigating its impact, I see this as a real opportunity for medicine as an institution to embrace telemedicine and remote monitoring of these devices. The time is now. We can do so much more for our patients and put both ourselves, our colleagues, our staff, and our patients at much lower risk by handling many routine tasks and visits for chronic disease or device management over the internet. Do it in cyberspace. There's no virus there. There are some obstacles to overcome. A Deloitte 2018 study or survey of U.S. health and healthcare consumers and physicians found that while 90% of physicians view virtual care as a positive thing, only 14% had the proper video capabilities to make that visit possible. We didn't have the infrastructure. We still don't have it today. The current coronavirus crisis presents us with a real opportunity. We can now work to improve access to care for all Americans via telehealth and remote monitoring of devices. Every physician and every healthcare system throughout the country should be examining their own video and remote monitoring capabilities, current practices, and they should be working to improve this infrastructure to make it happen. It's about time to stop talking about virtual care and opportunities for remote monitoring and begin to implement them nationwide. Remote monitoring has already proven to save lives from the data that I have quoted you and prevent stroke and heart failure admissions. Telehealth may very well provide similar benefits. I believe that these benefits will stretch long beyond our current coronavirus crisis. Let's use this as a real opportunity to move into the next phase of remote and virtual care in medicine. I promise you it will prevent the spread of disease now, and it may also solve many other healthcare system-wide problems in medicine going forward.